Our latest Gallup estimate is that 4% of the American adult population is newly insured this year. Now, that's important because there are not a lot of data on this topic, and so we have been attempting to look at it in many different ways. And this 4% figure comes from asking Americans from March 4th to the present who have insurance to tell us if their insurance is new this year and they didn't have it last year. And 4% of Americans say that's the case. So it looks like, very, very roughly, we can estimate that 4% of the population has been added to the rolls of those with insurance. About half of those came through the exchanges, but quite interestingly, half did not. The Affordable Care Act, of course, really emphasized using exchanges for the uninsured to get their health insurance, but our data show that about half, particularly younger people, and I'll get to that in a moment, got their insurance through some other mechanism. Those who are newly insured do skew a little younger than the overall population, but not dramatically so. And that's important because one of the efforts of the Affordable Care Act was to try to bring young people into the insured pool, primarily because they're less likely to drain on the system, and their premiums, therefore, would be valuable to pay for other people's insurance. Clearly, our data show that the newly insured have lower incomes than the population as a whole. But when it comes to health status, my conclusion is that the newly insured's self-reported health status, that is, what is your health, is roughly equal to the overall population. So perhaps good news and bad news for proponents of the Affordable Care Act. The newly insured do not skew towards those who describe themselves as having fair or poor health, and that's the good news. On the other hand, we don't see an inordinate skew on the part of the newly insured towards those who have excellent or very good health, and that's probably bad news because, again, the Affordable Care Act needed lots of people with good health to sign up. One final point, we estimate that about 4% of the population used exchanges to get new insurance, but half of those were replacement policies. That is, they already had insurance and then used the exchanges to get it. About half of those who used the exchanges were those people that we've called the newly insured. I'm Dr. Frank Newport, Gallup Editor-in-Chief.